Mobility, stability, and strength exercises. That is the key to getting over low back pain, and that is the key to preventing low back issues in the future. We know through research that movement is the best thing you can do for your low back, from walking to stretching to strength exercises. But when you're dealing with back pain, those seem like they're hard to do. These exercises that are coming after this introduction are designed to just get you moving again. They're very low intensity. What we want you to do is 1 set of 10 of each exercise 5 times a day. Once you get the hang of them, it shouldn't take you more than 3 to 5 minutes, so you can definitely fit them in. But a couple things to note: pain level, we want to keep it at a 4 or 5 out of 10 and below. If you jump above that, you went a little bit too far into the range of motion. We want you to back off. But we want you to keep moving within a good low pain or pain-free range of motion. From there, if you can squeeze in a few more times a day, that's great. Get a walk in the evening or in the morning, do them on the front and back side of that as well. Whatever we can do to get your back moving, because the more that you do these exercises, the more and quicker we can progress you in the office and get you out of this and prepare you to move on to the strength exercises that are really going to prevent back pain in the future. So work on this mobility. Let us know if you have any questions, but keep up with it, be consistent. And again, 5 times a day, don't slack, and we'll see you soon. Okay, we are starting off with rolling the posterior hip. We are looking at the glute muscles, all the external rotators, but basically what we're going to do is sit on the floor and sit on the roller. There's a few ways to take pressure off. You can put both hands back, both legs down. That way you can control more pressure, but our goal here is to cross that foot over and put as much pressure onto the side that we are rolling. We're going to hit 2 areas. We're going to hit a little bit closer to the sacrum. We're going to do 10 to 15 up and down like you see here. We're going from the crest all the way to the bone you sit on, the ischium. And then after those 10 to 15, we're going to roll a little bit out towards the hip where we're right behind the femur. And we're going to do another 10 to 15 repetitions here. Our goal is to just get some circulation, some relief. But ideally over time, as you do this a couple times a day, you decrease the tone in that tissue, and it allows you to have more flexibility, more mobility. And as you get out and run, or you get out and be active, you're able to move better, thus taking some pressure off of your low back and other stress areas. As this shows, always do both sides, but make sure you're doing this a few times a day. Next up is our hip flexor lunge stretch. As you'll see here, we're taking a lunge position, tucking our pelvis under, and then with the leg that's down, we are taking that arm overhead. Now, position matters on this one. Getting the pelvis tucked under and squeezing the glutes is a challenge for some, and it will take some work, but once you get it, you feel it immediately. From there, we're going to stretch forward and then over the top 10 times. We can also add in rotation. I have that in another video, but right now we're going to work on these 2 movements. Just with everything else, we want to do both sides, but this is a great movement to help take some of the pressure off the hip flexors, which anchors on the low back and can be causing you a lot of low back pain due to long sitting, traveling, or just inattention to this area. Thoracic spine extension over a roller, a great movement to loosen up the thoracic spine so it's not putting a lot of stress on the neck and low back. As you can see here, setup wise, feet are flat on the floor, knees bent, butt stays on the floor, hands brace the head so that there's not a lot of stress on the neck. And then as you extend over as far as you can, breathe out, let your body relax, and then repeat 4 or 5 going up, 4 or 5 going down, and never go to the low back because this is not a good movement there. We're now going to do a cat camel move, something you all are probably familiar with or have seen somebody else do, maybe even tried yourself, and might be doing with your back pain right now. But with this movement, I want to emphasize the breathing as you go up and down, breathing in and out, and getting into that full range of motion for whatever you are capable of doing at this moment. But this movement can be done 10, 15, 20 times. It's very low intensity, and it's just getting the spine moving in that flexion and extension. You're not getting any rotation, any lateral flexion. We are just getting those segments moving one on top of the other. Now on to one of my favorite stretches. This is called child's pose. Ideally, you can get into the position where your butt goes all the way back to your heels and you have the ankle mobility to get here. You may have to be up on your toes, and that's okay. What we're trying to do is push our chest all the way towards the ground, nice and slow, taking deep breaths so we can get a good relaxing stretch through our low back. From here, we're going to go side to side, which helps with the QL muscles, which are the rotational control muscles of the low back and can get strained if you are in any kind of rotational sport like golf or baseball or anything like that where you're required to twist and turn quite a bit. So going from side to side and breathing deep in each position will help you loosen that up. And this is just a nice, relaxing position to be in. Lastly, in our phase 1 exercises for low back pain is a seated flexion exercises where you are assisting yourself all the way down to the ground, putting the weight on your hands and taking it off the low back and just allowing that to stretch. It may take a couple minutes to get all the way down to the floor like this, but once you get there, try to relax, take 3 to 5 to 10 deep breaths in and out and let that low back loosen up. When you come up, use your hands, not your back, to press all the way up.